Hi, my name is Melinda Walker, and I'm one of the Concept Integration Laboratory Coordinators for East Carolina University College of Nursing. I would like to run through the simulation design template we use to create our scenario for our 6-hour simulation day. We currently use the template from the National League of Nursing. When writing the simulation using this template, you should be able to visualize who the patient is, what she is going through, and what needs to be done for the patient. It should be able to tell the whole story of the patient while she is in the hospital. Any information that is needed for the simulation should be on this template. On the first page, a brief description of the patient is given: name, gender, age, race, weight, height, allergies, who her physician is, her past medical history, history of her present illness, social history, her primary medical diagnosis, surgeries, and the nursing diagnoses that have been given for her. The second page is for any skills and cognitive activities the students are required to know or perform before the simulation. It also gives objectives, general and specific scenario objectives for the student. Some of the acronyms used for this simulation are the WE-APA, which is wash hands, introduce self, identify patient, acknowledge allergies, plan of care, and assessment of patient, or ADET, acknowledge, introduce, duration, explanation, and thank you. They can also use RETA, redness, edema, ecchymosis, discharge, and approximation during their assessment. The third and fourth pages are for fidelity. The setting will be in the Women's Birthing Center. Gamard's Victoria will be used. We will be using blood concentration for the hemorrhage. It also states what equipment will be used or attached to the patient at the very beginning of the scenario and what equipment will need to be available during the simulation. All of the medication that will be used or possibly used in the scenario are listed, as well as any documentation forms. During the simulation, we used a paper chart. The manual mode was used for the simulation, and the students were given any needed information prior to simulation, as well as what roles they will be in their scenarios. Page 5 is a full report for the instructor to give the students before the first scenario begins. Page 6 allows us to give any lab values that might be used, the provider orders that will be in the chart, and any home medications the patient might have been on before admitted to the hospital. Pages 7 through 12 gives us 3 separate scenario progression outlines that the operator is able to use during the scenario. These outlines were designed to be 25 to 30 minutes each and to run back to back, with each group giving a nurse's report to the next group coming up, allowing them to pick up where the last group left off. For each scenario, the students are required to do some form of WE-APA or ADET that was described earlier in the video. When they finish their assessment, there will be other skills they will be required to do. This includes performing a fundal massage, notifying physician of patient status, taking a telephone order from the physician, administering a medication, PO or IM, following up with a patient after a pain medication has been given, placing a patient on a bedpan, instructing a patient on medications, inserting an in and out catheter correctly, and just communicating with the patient in an appropriate manner. We do have to remember that even though these are written down on paper, they are not set in stone. You never know where a student is going to take the scenario, so you have to be flexible. The last page of the template is a debriefing guide that includes questions for the debriefing that are used after the scenarios are complete. That concludes my run-through of the 6-hour simulation day scenario template. Thank you for watching this video, and if you have any questions, you may contact me, Melinda Walker, or Dr. Melissa Beck. Thank you.